All right, it's 8:01, so we'll get started now. My name is Erik Daly, and this is our first in a series of Monday morning COVID-19 response team Roundup webinars. I'm a partner in Miller Johnson's corporate business section. I'm joined this morning by Rebecca Strauss and Sarah Willey, who are partners in our employment section, and we'll be going through a variety of updates related to small business funding and employment related issues. We hope you will join us each Monday morning at 8 a.m. for the foreseeable future, hopefully not too long, but as we're continuing to navigate the pandemic legal environment. Of course, we'll also continue to have webinars as breaking news or breaking legal developments in specific areas may warrant. For example, with the House of Representatives passing the American Rescue Plan overnight on Friday and the Senate taking that up in the coming weeks, I'm sure we'll have subject matter specific webinars upcoming as well, in addition to the Monday morning roundups. So with that, thank you for joining us. We appreciate everyone taking the time to begin their week to participate in this Zoom. And as always, our firm's approach to this is to engage with our clients, the community, and to collaborate so that we can collectively stay on top of breaking developments and position our community and our clients to come out of the pandemic as efficiently and quickly as possible. So with that, why don't we jump into today's agenda. Here you can see that the first topic we will cover is a quick update from me on small business funding. And why don't we skip ahead, please, in the slides to the first topic, which is something that I've gotten a lot of questions on, which is basically what's going on with the Small Business Administration and the Paycheck Protection Program. Many of our clients have taken out PPP loans or may apply under the so-called PPP2, the relaunch of the Paycheck Protection Program. And there are delays in the rollout of that program, other SBA initiatives, and delays in the forgiveness process for loans that were originated close to a year ago at this point. And the big picture is that a combination of technical issues, timing of the new PPP relaunch, the implementation of the Shuttered venue operator grant program, and then of course the change in administration have all sort of created this perfect storm that has delayed the forgiveness process and the rollout of different SBA initiatives. And last week during a webinar here with the local Michigan field office that had some participation from SBA's national office, they confirmed that they know their PPP forgiveness review process is behind schedule, especially for those larger loans. They know that they are, for example, outside of the 90-day review window for many of those larger loans. And they didn't speculate when their backlog would begin to clear, but they did emphasize that borrowers who are in that situation outside of the 90 days should not take that as a troubling sign in and of itself, and that it's really just the fact that the SBA is behind in their review process. So I know a number of people and clients are hoping to get that determination sooner than later for a variety of reasons. And the SBA is asking for patience on that front. And hopefully they can start to get the backlog cleared a little bit here. There's a couple of statistics here on the slides from the SBA's website, which has a lot of good data on it. And you can see that about $83 billion in PPP loans, representing nearly 250,000 applications, are under review by SBA. And I hope that gives some reassurance to people that if their loan has not yet been fully forgiven, it's really just because, hopefully, just because it's caught up in this larger system backlog and not necessarily because of a problem with your particular forgiveness application. And then you can see also that there's quite a lot yet to come in terms of loan forgiveness requests, with nearly 300 billion and in loan dollars and more than 3 million applications still out there and not yet received by SBA. And then separately, we're still waiting on some updated frequently asked questions based on the Economic Aid Act, which was passed in late December of 2020. So things are just kind of trickling along at SBA right now. And, with the American Rescue Plan passing, my speculation is that we may not see a lot of change in that pace. We may see some developments this week and next, but then the SBA is going to have a lot on its plate in the upcoming weeks and months, assuming something like the American Rescue Plan does in fact pass Congress and get signed into law. So next slide, please. Okay, just very briefly, a couple of recently announced PPP modifications or developments. And I'll go through this quickly because you can read about it in a client alert that we did early last week. But right now we're in the midst of what the White House and SBA are kind of calling a pause in larger PPP loan applications. And basically, even though there are still significant appropriations available for PPP, until the end of the day on March 9th, only the smallest businesses, those with 20 or fewer employees or self-employed individuals, are able to have their loan applications processed. The administration stated they really wanted banks and all the constituents involved in PPP to be focused on that group of potential borrowers to make sure that they access PPP well before the current appropriations expire on March 31st. But at 5 p.m. on March 9th, the PPP will reopen to everybody who's eligible, and the funds will be available under current law, at least through March 31st. And we'll see if that date gets extended. I don't believe the American Rescue Plan presently extends the date for PPP appropriations, but that may ultimately work its way into the bill. So we'll keep an eye on that. Other changes include more generous loan calculations for sole proprietors, independent contractors, and self-employed people. And basically, the upshot of this change is that that group of borrowers will be able to calculate their loan amount based on gross income rather than net income, which makes a big difference to quite a few of those individuals. It's unclear whether that'll be a retroactive kind of change where those borrowers will be able to increase their original loans, but we should get some guidance this week about whether or not that is the case and how this change will be implemented. Next slide, please. Just very quickly on these points, the other recently announced modifications were basically relaxing some of the restrictions on PPP access for small business owners who may have had non-fraud related felony convictions or who were delinquent in student loan payments, as those were requirements or criteria that SBA had originally implemented as part of PPP eligibility that, given the amount of appropriations still available and concerns about equitable access to funding, are being relaxed to allow for more borrowing on that front. And then similarly, there's been some confusion about whether lawful U.S. residents who are non-citizens can be owners of PPP borrowers. So SBA is kind of clarifying that they may be and how they should disclose their tax information to be compliant with the loan applications to be able to borrow under the PPP. And as I mentioned, the big rationale for a lot of these changes is that there were concerns about equitable access to the PPP funds. and that only about $3 billion of the $15 billion set aside for low and moderate income businesses had been deployed at that time. So I think SBA and the administration are hoping to see that number increase before the end of this 2-week pause. Next slide, please. Okay, and then just looking ahead a little bit, as I mentioned, the American Rescue Plan passed the House overnight on Friday. Technically, I think it was early Saturday morning. So that's heading to the Senate, and there will probably be some changes. Certainly the minimum wage increase, is a topic that is likely to be debated heavily along with others. And we'll probably see this bill go through some kind of reconciliation process with the House, but some of the PPP changes, really not game-changing type of things for our clients for the most part, I would say. There's some additional appropriations in there, about $7 billion more. And you can see that raises the total amount of appropriations to about $813 billion, which includes amounts authorized under prior legislation as well. So obviously a significant amount devoted to small business relief. The American Rescue Plan would open up the PPP to more nonprofit borrowers, subject to some lobbying limitations. Right now, only certain types of not-for-profits are eligible, and they're not measured for eligibility on a per location basis. So some of that will change if this becomes law. And then the other newly eligible businesses would be non-print or internet based media outlets that otherwise qualify. There are no new authorized or forgivable uses of PPP funds. So that hasn't changed, or it doesn't look like it will change relative to the December bill. And again, nor does it presently extend the date that PPP is set to expire on March 31st, although I am skeptical that will remain the case. But for now, people should plan on that being the end date. Next slide, please. Real quick update on the Shuttered venue operator grants. This was a program that was created by the December Economic Aid Act. And as opposed to the PPP, which is a forgivable government guaranteed loan, the Shuttered venue operator grant is a true grant. And it's taken quite a while to get this program off the ground because it requires direct funding by SBA rather than intermediary banks. So this is really, new territory for SBA. It's not something they've really done in the past. And it's required potential grant recipients to register with government websites that they may not be familiar with. So it's taken a long time to get this up and running. And the delay has created some tough decisions for those who are eligible for both PPP and the Shuttered venue operator grants, since you can't use both. And in fact, you can't even really apply for PPP and accept a loan or have a loan approved if you want to use the Shuttered venue operator grant. This is part of the reason why I suspect that the PPP deadline will be extended. Can't guarantee that, but it seems like that would be the right thing to do in light of this delay. So just make sure if you're eligible for both programs potentially, you want to be really careful about how you proceed so you don't disqualify yourself from some other programs. Next slide, please. Really, in terms of potential changes to the SVOG under the American Rescue Plan, there's not a lot. There's some additional funding, about $1.25 billion, and some provisions that allow SBA to develop an alternative grant application system to make that less cumbersome, especially for smaller businesses who are not used to registering with the system for award management for the federal government, for example. And then one last thing I'll mention on the Shuttered venue operator grants, for those who are planning to apply for this, I noticed this morning that SBA updated their frequently asked questions for this program pretty significantly at some point late in the day yesterday. So there are new FAQs available through the SBA website if you want to look at those, and we of course will be looking at those as well. Next slide, please. Okay, so then looking at a potential new SBA/American Rescue Plan program. We've got a $25 billion appropriation in that bill. It's not law yet, but it's included in the House approved bill for what's called the Restaurant Revitalization Fund. And essentially this would be very much like the Shuttered Venue Operator Grant Program, in as much as it would not be a forgivable loan. It would be a true grant, a pretty flexible grant in terms of what it can be used for, more flexible than the PPP funds, for example. And this would target restaurants, caterers, bars, pubs, basically anywhere that people gather for being served food or drink. It would not be available to larger restaurant ownership groups, and the current legislation says that would be any business that with its affiliates has more than 20 locations, even if those locations are different chains or franchises. And it also generally excludes private equity backed restaurants and bars. The grants would be reduced by any prior PPP loans received, and any business that received a Shuttered Venue Operator grant, again, would not be eligible for this particular grant. And it's just another reason you want to make sure that before you go ahead and start applying to different programs, you make sure you consider the ramifications on possible participation in other relief programs that may be better if they become into law, in the case of the Restaurant Revitalization Fund. So we're tracking this one closely. I'm sure there's more to come here. Even if the law itself doesn't change, there will need to be a lot of or the language of the bill doesn't change and this becomes law as written, there will need to be a lot of regulatory implementation and guidance to put it into place, similar to the Shuttered Venue Operator Grant Program. Next slide, please. All right, I'm getting close to the end of the small business funding update. So just a few other things I want to call out about the ARP. One is that there's a $15 billion appropriation in the House version of the bill for new EIDL advances. So this is a small business administration grant, essentially, under a loan program that already exists that would target the hardest hit kind of mom and pop small businesses. I believe this would be, I want to say from memory that it's 10 or fewer employees for the most part, and a very significant impact economically from COVID in order to be eligible, something on the order of 50% kind of economic hardship to be prioritized here. But that's in the current House bill. There's also significant appropriations for enhancing and improving SBA's resources and website, just to make things more coherent and equitable and efficient, which strictly speaking, just from the accessibility and efficiency standpoint, I would greatly appreciate. And so hopefully the SBA and Treasury websites can be brought together more coherently to make sure everybody's getting the guidance when they need it and can access it easily. And then the last thing I wanted to mention was it's kind of a longer term aspect of small business stimulus or relief. There's a $10 billion appropriation to what's called the State Small Business Credit Initiative Act. And this is a program that was put in place, I believe, originally in 2010 during the Great Recession timeframe. And the idea was to fund regional, state, and local small business lending and financing programs with this money as kind of seed money so that it could be leveraged into even more funding. So kind of a down payment on additional funding coming in for those types of businesses, small businesses. And so the idea is that 10 billion could be leveraged up by the states into 50 or 100 billion in new financing for small businesses. That would not be a grant necessarily or forgivable, but would be kind of longer term targeted financing for small businesses. And with that, I think I am done with the small business funding updates. We can move to our next slide, please. And I'm going to turn it over to Rebecca Strauss and Sarah Willey to talk about some of the employment law developments. And if you have questions about small business funding issues, you can submit those in the Q&A, and we'll come back to those at the end. So I'll turn it over to Rebecca.
Thanks, Eric. I appreciate it. Hi, everyone. This is Rebecca Strauss. I am a partner here at Miller Johnson in the employment law section. And if you have attended some of our other webinars, then my name and voice probably sounds familiar to you, and happy to be with you by video today too, so you can put a face with the name. I'll be covering the first two topics in the employment law section, FFCRA and vaccine update, and then Sarah Willey will take over from there. So the FFCRA update largely entirely this morning involves the package that was passed by the House late Friday, early Saturday morning that is on its way to the Senate. It includes, as Eric mentioned, lots of things, right? He talked about some of them. It also includes revisions to the FFCRA. So that's what I want to give you a heads up on this morning. If the legislation that has been sent to the Senate remains intact regarding the changes to the FFCRA, these are the changes you can expect to see. First of all, how about something that's not a change? There will not be an extension of mandatory leave itself. Okay, so if you remember, there was mandatory leave through December 31st. And then when that expired, legislation that passed at the end of December did not extend mandatory leave, but allowed employers, non-public body employers, to continue taking a tax credit for pay they gave to employees that would have qualified as FFCRA pay if the FFCRA had been extended to March 31st. That system that took us all a minute or two to get our heads around, under this new legislation, that system will continue, but the tax credits will now be available until September 30th. September 30th will be the new expiration date. So no extension of the mandatory leave itself, but if you provide paid leave for leave that would have qualified for the FFCRA, had the FFCRA been extended till September 30th, you can get the tax credit. Okay, so that's one big change, is the extension from March 31st to September 30th. Next, for our public body clients, this is going to be very interesting to you. You are all painfully aware that under the original FFCRA, local governments, public body employers were not entitled to that tax credit. The new legislation literally just deletes the paragraph that said local public bodies are not entitled to the tax credit, which means that local public body employers will be entitled to the tax credit. So that's a big change. Another significant change is Congress has reloaded the 10-day emergency paid sick leave bank that employees can, I was going to say entitled to, they're not entitled to it anymore. But if you remember, the way that the system works now is you can take a tax credit if an employee would have been entitled to the FFCRA had the FFCRA been extended. And as we advised on several webinars and many client counseling calls, right, that 80 hours or 10 days, work days for emergency paid sick leave was a set amount that did not reload when 2021 began. right? So once an employee ran out of their 10 days of emergency paid sick leave, that was that. You could not take a tax credit for paid wages. You paid the employee if they were gone for qualifying reasons, but if they had burned through their 10 days. So starting April 1st, that 10-day leave bank reloads. It reloads. So if you are an employer that is choosing to offer leave that is consistent with the old FFCRA, so that you can get your tax credits. In other words, you've decided to extend leave only to the extent you can get those tax credits. Employees will have another 10 days. Okay. The new legislation also adds a reason someone can qualify for that emergency paid sick leave tax credit, and the additional reason is related to the vaccine. So if they are missing work to get the vaccine, or if they are missing work because of effects after the vaccine, as we know now, some people are having effects significant enough a day or two after the vaccine that they're unable to work. That would be a reason for emergency paid sick leave. The total amount of credit per employee has been increased from $10,000 to $12,000. And finally, Congress has added a non-discrimination clause. So you can only get these tax credits if you do not discriminate in how you dole out paid sick leave based on full-time status, seniority with your organization, or discriminating in favor of highly compensated workers. Okay. Now, this has just passed the House. It's going to the Senate. As we know, there's a significant issue with the minimum wage provision that was included in the package. The Senate parliamentarian said that it cannot be included in this legislation. So we expect that to be deleted from this package. We do not know how long it will take to rewrite and then get this through the House and Senate through reconciliation. The deadline that the Biden administration has set is March 14th, because that's when unemployment benefits currently expire. And this package also extends unemployment. We understand from contacts in the Senate that it is due to be passed well before March 14th. So, of course, we will let you know when it passes. We will have webinars dedicated to the nitty gritty of what this legislation does. If there are any changes to the to what I just described to you, obviously we will address that once the legislation passes, but we wanted to give you a heads up in what you will likely see in the final legislation. Next slide, please. Quick vaccine update, not a lot to share with you now, but it is March 1st. So what changes as of March 1st in Michigan? As of March 1st, the state of Michigan has said that frontline essential workers in the food processing and agricultural industries are now part of the prioritized group for getting vaccines. So let's pause and think a minute about what that means. It means that organizations that administer the vaccines are now permitted by the state to administer the vaccines to workers in the food processing and agricultural industry. It does not mean that all of those employees will automatically be able to get the vaccine as of today. This is, of course, limited by supply, and we have seen differences county by county, right, in terms of who is permitted to get the vaccine when, based on the supply in that county. So if you are in these industries, you have reason to be optimistic, but you will have to work with your local county health department to determine when your employees will be eligible based on where they are. Also note that it may be that the group of employees who now qualify is a little broader than what you might think when you hear essential workers in the food processing and agricultural industry. My research on this, which consists of talking to a DoorDash delivery person, indicates that DoorDash has sent messages to its delivery drivers in Michigan saying they are included in this group and to start signing up with their counties as counties permit. So it may be a little broader than what we initially think, but as that develops, we will keep you informed. So that is what is new as of today in the state of Michigan. Other quick update, just how far we're coming in the state of Michigan in the vaccination process. According to the state's dashboard, 44% of persons 75 and older have received at least their first dose and some their second. 40% of adults between 65 and 74 have received at least a first dose. And for those younger than 74, it's 12% or below that have received their first dose. So after we get through this next phase, which includes, again, agricultural workers and others, after that, we will get on to individuals, other essential workers, and then individuals with risk factors, right, that make them more likely to get seriously ill if they do get COVID-19. According to the state, we're looking at end of April, early May before we get to that group. But as you know, that's very fluid. So stay tuned. And it looks like the state is still expecting all others to start being eligible sometime around early to mid-summer. But again, as we know, that is that keeps changing. So stay tuned. Okay, that's what I have for you in terms of vaccine update. Next slide, please. And I will turn it over to my partner, Sarah Willey, to talk to you about one of the biggest questions we've been getting lately. What workplace rules are still in place? Sarah?
Thank you so much, Rebecca, and happy Monday morning to everyone, and happy March. How about that? We made it through February and into March, so congratulations on that. I'm Sarah Willey. I'm also a partner here at Miller Johnson, and have been doing a lot of work on the COVID front, for the last year or so. And I'm very grateful for my partners, Erik and Rebecca, as well. I'm always amazed at the level and depth of expertise and knowledge of both of them. So thank you for your insight today. I'm going to talk to you about three things. The first one is what rules are still in place, and then I'm going to provide an update on quarantine and isolation requirements. We've seen a little bit of changes in that regard from the CDC. And then finally, I seem to be getting a lot of questions lately about travel restrictions, and I'm guessing it might have something to do with spring break coming up. So I will cover that. So first topic, what workplace rules are still in place? We seem to be in a place right now in which things are going better from the COVID front. Our numbers are down. People are getting vaccinated, and we seem to be very hopeful, which is wonderful. But that's leading people to scratch their heads and think, do I still need to be doing all of these things in my workplace, and do I still need to be following these protocols? And the short answer is easy, and that's a big yes, you do. All of those requirements with which you are familiar are still in place. So in Michigan, those come from two places. The first place, which is the most significant one, are the MIOSHA emergency rules. Those were put into place on October 14th of last year, and they are in place for at least 6 months. So that means until at least April 14th. Of course, MIOSHA could change them or rescind them before then. I don't think MIOSHA will, I will be honest. So I think we can assume those will be in place until the 14th. And those rules are where we get the requirements for things like you have to have a COVID preparedness plan. You have to do that daily health screening. Nothing has changed with regard to that. We are still supposed to be doing that. And also the remote work requirements. So the MIOSHA emergency rules say that all employers have to allow their employees to work remotely if feasible, and have to have a remote work policy. Again, nothing at all has changed with regard to those requirements. So employees who have been working remotely throughout this pandemic should continue to do so unless we can articulate a reason why they need to come back into the workplace. I see many employers anxious to sort of set that return to work date, tell everyone just come back on April 1st, etc. As of right now, that sort of approach isn't consistent with what's required under the MIOSHA emergency rules. The second set of rules in Michigan from which workplaces are getting direction and mandates are those Michigan Department of Health emergency orders. That now, very few provisions in the current MDHHS order actually is specific to workplaces. Most of the workplace requirements are in those MIOSHA rules that I just talked about. But we do still have an emergency order in place that was issued on February 4th was the last one, and it continues all the way through March 29th. That talks about gathering restrictions and food selling establishments and entertainment venues and recreational venues, how many people can be in a restaurant, et cetera. And so that order is still in place as well. Okay, next slide, please. Let's move on to what are the current quarantine and isolation requirements, vaccinated and not. So let me just take a step back for a moment and remind everyone that in Michigan, we actually have a law on the books that requires employers to be following the CDC quarantine and isolation requirements. And if we require an employee to come back to work outside of those requirements or otherwise don't follow them, it can result in a private cause of action, meaning we could get sued for it, okay? Now, that law, which is now it's called the COVID Employment Rights Act. It started as Public Act 238, and then it got amended by Senate Bill 1258 and renamed the COVID Employment Rights Act, okay? That is tied, all of the quarantine, both the quarantine and isolation requirements in the COVID Employment Rights Act are tied to the CDC guidance. So it's very helpful for employers to be monitoring updates from the CDC as to what it is recommending with regard to quarantine and isolation. So I'll tell you what those are. So let me first remind everybody the difference between quarantine and isolation. So a quarantine period is when somebody is exposed to another person who's been confirmed to have COVID, okay? So we're talking about an employee who doesn't have symptoms and hasn't tested positive, but they were in close contact, meaning within 6 feet for a cumulative total of 15 minutes over a 24-hour period with someone who did have COVID, okay? So interesting, a couple of interesting developments with regard to quarantine requirements. The CDC is now saying that an individual who tested positive for and recovered from COVID in the last 3 months does not have to quarantine after close contact with a known COVID case, right? So there's currently a 90-day period. You have an employee who was a positive COVID case, they recovered, they came back to work, and now maybe at work they had close contact with a coworker who's tested positive. That first employee who had and recovered from COVID does not have to quarantine. Also, the same rule applies to an employee who's been fully vaccinated. And fully vaccinated means both doses and 14 days after the second dose. So same rule, if you have maybe an employee in your workplace who has tested positive for COVID, so you're doing your contact tracing, an employee's been fully vaccinated, does not have to quarantine according to the CDC for 90 days after they've been fully vaccinated, meaning the 14 days after the second dose. And again, as a reminder, so that the general quarantine period is 14 days from the day of last close contact, although the CDC does allow local health departments to use a shorter quarantine period, a 10-day quarantine period, if they believe it's appropriate in the circumstances. With regard to isolation, the rules have not changed with regard to isolation, but I'll just remind everybody what those are. And isolation refers to a situation in which an employee actually has tested positive or has symptoms of COVID, okay? So it's not a close contact situation. This is somebody who actually has symptoms. The CDC says that anybody who's tested positive has to isolate for 10 days after the onset of symptoms and until there's a resolution of fever for at least 24 hours and improvement of symptoms otherwise, okay? So usually that does mean 10 days after symptom onset. My experience has been that 10 days is a long enough period of time that employees have also resolved fever and symptoms have improved. If it's an employee who just tested positive and never had symptoms, then that 10 days start from the date of the test. And just so you know, there is also guidance in the CDC materials that talk about if an individual is severely immune compromised, that isolation period can be extended. That's usually extended by the local health department. So if you see something like that, a local health department telling an individual they actually have to isolate for more than 10 days because they're immunocompromised, that's coming from that CDC guidance, and you should follow that. Okay, next slide. All right, hello, spring break. Let's talk about CDC guidance on travel. Getting a lot of questions from employers about how they should handle employees going away for spring break, whether they should quarantine when they get back, whether they should get tested, etc. So let's start with what the CDC is currently saying about travel. And I will tell you, if you Google the CDC COVID travel recommendations, they've got a very good webpage on it, and a webpage even with a few infographics that I think are well done. So you can also refer back to that. The CDC is currently really recommending that we not travel, including travel within the United States. And I know that's probably surprising maybe to many folks to hear, because I think a lot of us are traveling within the United States and otherwise, and I think a lot of people have spring break plans to do that. Now, that is a recommendation from the CDC. I am not telling you that you have to tell all of your employees they're not allowed to go away for spring break. I would not do that to you. But that is the starting place from the CDC. The only things that the CDC is mandating now is that everyone has to wear a mask on public or on transportation where there's a mass amount of people on it, so airplanes, buses, trains, etc. And people have to get a negative test before they return to the United States. So any of your folks who are traveling to Mexico or otherwise are going to have to get a negative test before they are allowed to come back. And I would also remind everyone to check local city and county requirements, both where you're located and where these people are going, because there can be additional travel restrictions, quarantine requirements, etc. Okay, but the only two musts from the CDC are you got to wear a mask when you're on that mass transit, and you have to get a negative test to get back into the United States. Okay, now CDC recommendations are as follows. They're saying before you travel, you should avoid any sort of crowds or large social gatherings for 14 days before you go. Obviously, the idea is that don't engage in an activity that makes it more likely that you could be exposed to COVID before you travel. Okay. They are also recommending that people get tested 1 to 3 days before they begin their trip. Okay, make sure you're negative before you go. That's not a requirement. And then, of course, during the travel, they recommend you follow the COVID protocols that we've all come to know very well. Wash your hands, wear a mask, don't get close to others, all of those things. The most interesting piece and the part that's most relevant probably to all of you is the CDC's recommendations about what happens when you get back. And the CDC is recommending that people self-quarantine for 7 days after return from travel, and also that they get tested 3 to 5 days after they return. Now, interestingly, they say even if you get tested 3 to 5 days after you return and you get the results back and it's negative, you should still quarantine for at least 7 days. In addition, the CDC is saying that you should quarantine for 10 days if you don't get tested at all, okay? Now, those are recommendations from the CDC. I think it's really important for you all to be aware of it because your workforce probably is aware of them, or at least some of them, because they can go on websites in Google, et cetera. So I expect you probably are going to be getting questions about this and maybe hearing from employees that they need to quarantine because they're traveling for spring break and they need to work from home for a period after that, perhaps. So I would also add that if yours is a workplace for which it is simply not an option to have a large portion of your workforce quarantine at the same time when they all get back from traveling the same week, right, for spring break, whether it be even 20%, that's not workable for a manufacturing facility, you might consider really stepping up compliance with regard to your COVID protocols in that 10 to 14 days after spring break ends. In other words, reiterating in communications to employees the obligation not to come to work if you have symptoms or if you've been exposed, right? Some employers are considering mandated testing, of course, but that goes hand in hand also with quarantine. But it's really focusing on compliance with the protocols that we have in place in our workplaces, the daily health assessments, the distancing, the wearing of masks, et cetera. I think those things are going to be more important than ever if you have a large number of employees who are going to be traveling and then coming back into the workplace after spring break. So with that, those are all of the topics that I had planned to cover this morning. Erik is back. I'm going to hand it back over to Erik. Are there a few questions, Erik, that we want to take before we sign off?
There are a few questions, and thank you very much, Rebecca and Sarah. That was terrific. Very helpful updates and timely, relevant to what we're going to be looking at over the next month or so. In looking at the Q&A that have come in, I'm maybe just give you and Rebecca a moment to glance through those, and then we can take a few of those questions. I do want to be mindful of the overall time limit. But before jumping into the Q&A, I wanted to mention a couple of things. One is we will be continuing this Monday morning COVID Roundup series next week and again, foreseeably. And some things on the radar for next week, of course, we'll continue to be tracking the American Rescue Plan legislation. A couple of things we plan specifically to delve into next Monday involve immigration-related reforms. So if that's an area where you or your colleagues have interest, you want to have that on your radar. And then another business stimulus possible piece of legislation called the GYMS Act, which is focused on gyms, fitness centers, health clubs, things like that, that was not included in the American Rescue Plan, but has sort of a separate legislative track in the House. We're going to have CJ Schneider, who is one of our partners, talk a little bit about that next Monday, plus whatever else comes up throughout the course of the week this week. So with that, I will look at the Q&A here. And Sarah, I don't know if you prefer to choose some of the Q&A. It looks like most of these are kind of FFCRA related, vaccination or quarantine sort of related issues. So I don't know if there are any in here, Rebecca or Sarah, that you would like to call out in particular.
I can take a few easy ones real quick that have to do with quarantining. The quarantine and the vaccination question, I think we can tick off a couple of those easily. The first one was the quarantine regarding quarantine for fully vaccinated individuals, was that for 90 days as well? Yes. So for 90 days after somebody's been fully vaccinated, that person does not have to quarantine if they've had close contact, okay? And another question tied to tying that to the spring break requirement, right? Should there be quarantining for those that had the vaccine upon returning from spring break? I think practically speaking, we can apply that same rule to the spring break quarantine. If somebody's been fully vaccinated within the last 90 days, they do not have to quarantine, period.
All right.
All right. Thanks, Sarah. Is this a good time for me to jump in with some of the FFCRA questions?
Yep, I see a lot of those, so you take it, yes.
Okay, I'll take a few real quick, and if I don't get to your specific questions, because I'm kind of consolidating common themes, right? One point of clarification, I want to make sure you understand that under this legislation that has passed the House but not yet the Senate, local public employers are able to take the tax credit under the FFCRA. Okay. They will be able to take the tax credit under the current version of the bill that passed. This is a big change for our local public employers, big. You may need help. Miller-Johnson guidance or guidance from your CPA on how to implement that. That is a big change. Okay. Lots of other questions. I'm just going to consolidate them all into how does this reload of the 10 days / 80 hours of emergency paid sick leave, how will that work under this proposed legislation? The legislation is worded in a very convoluted way. Sometimes I feel like members of Congress get paid by the word and not by the thought. So let me read it to you and then let me tell you how I am interpreting it. And as always, this is subject to guidance from the government, right, after it passes. This is what the statute says. After March 31st in 2021, in any calendar year, the total number of days of emergency paid sick leave is 10, right? So you aggregate it per calendar year, right? Starting In 2021, after March 31st, 2021, you aggregate it by year. So by year, it's 10 maximum. And then it says the aggregate number of days so taken into account during preceding calendar years in such calendar year other than the first quarter of calendar year 2021. So what the heck do all of those words mean? This is the way I am interpreting it. Keep in mind that this is as clear as mud, but the way I am interpreting it right now is that after March 31st, 2021, for those of us that can do math and calendars, April 1st, 2021, as of April 1st, 2021, if you have an employee that had already used up those 10 days, and then they have a qualifying reason as of April 1st for emergency paid sick leave, you can pay them their wages up to 10 in 2021, starting April 1st, and you can take a tax credit for those paid days. The total, some of the questions came in, does that mean employees get a total of 20? No, you get a total of 10 per calendar year. In 2021, that total of 10 per calendar year does not count the first quarter. Okay, so again, they could have written this a little more clearly. I am just the messenger. Don't shoot the messenger. And after it passes, we expect, I would hope for some guidance from the federal government, right? From the Department of Labor, clarifying that in plain language and clearing up any ambiguities that I'm sure will come up in specific employee circumstances. Okay, that's all for me, guys.
All right. Thank you, Rebecca. Sarah, are there any other questions that you would like to take up before we log off for today?
No, I think we're just about at 9, so this is a great spot to end, Erik. And thanks to you and Rebecca for this Monday morning update.
Yeah, thank you. Thanks, Sarah. Thank you, Rebecca. And thank you to everybody who logged in this morning to join us. We'll look forward to continuing this new Monday morning series going forward. And there's a link in the chat box if you want to take a look at other webinars that Miller Johnson will be doing this week across different practice areas. And with that, we will sign off and look forward to a great week ahead. Everybody stays healthy and safe and has a great week. Thank you.
Hi, everyone.
Bye-bye.